Welcome to Just Say Hey, the podcast where we talk about the things that matter to small farms. Today is cool. I talked about it a couple weeks ago that I was going to have this lady here, and I tell you, I've known her for a long time, but you cannot imagine the amount of respect I have for her, and it's probably not for what she thinks, but she is a nurse practitioner here at in our local area, and just does an absolutely fantastic job. And if you could hear the people who are patients of hers talk about her, you would think she has wings sitting behind her because they just absolutely love her. Our kids rodeo together. We've roped a little bit together. We have a lot of mutual friends in common, but she's an absolutely wonderful person outside of being an exceptional healthcare provider. Leslie Ferrell is here with us today, and we're going to get into it.
Welcome to Just Say Hey, the podcast where we talk about what matters to small farms, whether it's business, marketing, agronomy, equipment, livestock. If it matters to small farms, we'll probably talk about it here. So let's get into it.
Thank you. Thank you so much for having me. That was an amazing introduction.
I was going to try to get Lance and Larry to write something down, but I figured you might not want to hear what Lance and Larry have to say.
I can imagine what they would have to say. It's good. It's good. Yeah.
You know, we were talking off camera here just a little bit ago about my daughter and I, Kara, whom you were influential in her journey into healthcare. She and I were talking about the situation and the problem we have with rural healthcare, not just in our own community, but in rural America. There was, I think it was like 60 or 100 hospitals have closed over the past, 10 years because of funding issues, because of, we were talking about the rate that a hospital or a clinic gets paid for Medicaid versus Medicare versus commercial insurance versus cash pricing.
Yeah. So when we think about that in the context of rural America, we think about access to health care and all of those things that people struggle with in our area. But when we think about hospital closures and those sorts of things, the thing of it is that the population is not flogging to rural America. There's no industry here. There's no, jobs that produce, good paying jobs and commercial insurance and those sorts of things. And so I've been in healthcare for over 25 years now. And
I've been, look it.
Yeah. I know.
You look great.
Thank you. I feel old, but anyway, I've been a nurse practitioner since 2008, and when I first came to town, the coal mines were thriving and flourishing, and when we think about healthcare and how we get paid, we speak about that in terms of payer mix. And so when we think about payer mix, we think about, how do we get paid for the goods and services that we provide? And the way is commercial insurance, Medicare, Medicaid, and then you always have a small amount of cash pay. And so when I first came to town in 2008, that was about, I'm going to say, 60, 30, 10 split.
Right.
And so 60% commercial and then 30 Medicare and then a little bit of Medicaid funneled into that. And over time, that has pretty much turned upside down. The last time I looked at this about 5 or 6 years ago, we were running about a third, and I'm sure that is even worse now. And so the dollars that we receive for patients who have Medicaid is a fraction of the cost of what we bill.
Right.
We might bill $100 for a service and receive $20 of that back. And so it doesn't take a brain scientist to figure out that organizations just can't survive under those terms. Doesn't mean that those people don't deserve quality health care just like anyone else does. But when you don't get paid for the goods and services that you provide, how can you stay afloat? You just can't.
That's right.
And so across America, what we're seeing is smaller entities and smaller hospitals being swallowed up or merged with larger organizations just to keep the boat afloat so that people can have health care.
And our hospital here is, I believe it's classified as a critical access. Because we are a small community, even though geographically we're pretty good sized. It's pretty much the southern tip of Illinois, but we're the only one. I mean, Harrisburg has a hospital and we have a hospital, but Harrisburg has switched their provider mix to focus on mental health. So when you talk about the rest of the injuries and illnesses and healthcare issues we have a real small. How many beds does Ferrell have?
I think being critical access, I think 25 beds maybe is because
Yeah.
there's some rules governing that. I don't want to speak to that because I don't want to be wrong, but they can't increase those beds because of the critical access status, and we don't want to forgo that because that could affect our reimbursement as well.
Right. And, one of the things that we talk about when we have access is, when you think about the number of providers there are versus the number of patients, what is that ratio these days in this area?
I don't know as far as number-wise, as far as provider to patient ratio, but I know that family practice providers are overran in our area. It seems, we think that we're saturated with providers, but we're really not. New providers come in all the time and they're just busy within weeks. When I first came to Galatia, I was the only provider within 10 miles of either direction. It's not like that anymore. Of course, we've migrated to Harrisburg because, when the coal mine shut down, we have to follow the money and go where the money is. So,
and you say follow the money. I because I know you so well that you're not talking about getting rich. It's not like you're driving living in mansions and driving cars. You have to have enough money to pay the light bill and pay for the real estate and the taxes in Illinois and all of the things that you have to do. Cost dollars, whether it's the power, the internet, the things you need to run a business of any kind. Healthcare is the same way, and so you have to go where that population migrates.
Healthcare, I think, is even worse because it's so expensive to provide. The other, medications are expensive. People can't afford their medications. Providing imaging services or having surgery or anything like that, it's just really, really expensive.
Yesterday afternoon, one of my best friends had surgery, and I drove down to Nashville to see him. And the gentleman we were there with, we were at a kind of his friend's house. This guy works for a company that they track people's medication through insurance claims to see if people are on track for, say, their diabetes medication, if they're not getting enough of their medication. And so the insurance companies are looking at this because they're not going to lose money. They don't care if you lose money.
Right.
They don't care. But they're not going to lose money. And the idea of that these are businesses that even if they're not for-profit business, because I think is Ferrell nonprofit?
It's non-for-profit.
Yeah.
Ferrell and Harrisburg both are not-for-profit.
Right.
Yeah.
So even if they're not for profit, they still have to pay the light bill. The energy doesn't come to them for free. Janitorial doesn't come to them for free.
Right.
Trash removal is a challenge because of biohazards. And, we have to get, healthcare has to get paid for this.
On top of the nursing shortage,
Oh.
they have to pay for their people, but there is no people to pay. And so, yeah.
I mean, Kara would tell me she was, my daughter was, thanks to you, she was in on the floor for 2 years and she loved night shift, loved it.
Yeah.
But, she would come home and say that she would even talk about how she was fanatical about making sure her patients were cared for. Yeah. But she said it's tough because when you get the more patients you get in a night, when you get things like critical where they're doing what did she call it, the heart medications and the drips, it's tough.
It is hard,
and you don't have enough. So at what point does personnel, the inability to have personnel, impact healthcare?
That's a fine line. Patient safety comes into play there, as Kara I know could speak to, but. And that's a problem that affects not just rural America. That's a healthcare problem as a whole in our society, across the whole country.
Yeah.
Yeah.
One of the things we talk about with access is, telehealth has become such an important thing. And my mom's 84 years old, and I still, when she has to have a doctor's appointment, she's in Harrisburg and uses a different, uses a doctor over there.
Yeah.
I have to go show her how to make the video call. But that educational process of teaching our older to be able to do that, but it does take a little bit of the burden off of, the office visit.
And it takes a little burden off of the patient. I was saying earlier, 1 in 5 individuals in our area are below the federal poverty level. Yeah. We have, when you think about telehealth and video visits and those sorts of things, we have a lot of places in Saline County even that still don't have access to decent internet service.
Yes.
And so we're trying really, really hard to get access out there, whether that's through video, telephone, face-to-face visits and that. But sometimes it's still not enough.
When I lived in Atlanta, this was 25 years ago.
Yeah.
We talked about, because we were right at the .com bubble. So everything my wife and I did, we worked in a lot of the .com boom era in there. And even back then, we were talking about last mile issues. Well, what we're finding out is this is the last mile. These rural communities are the last mile. And there are people that I know, that I'm sure you know, that they're still on dial-up.
Yeah.
Or using their cell phones, which we're still at the last mile even with cell phones, because there's no towers. I mean, we don't get very good signal here.
We were on only cell phone at our house out on Route 34 until, I don't know how long ago, 6-8 months ago.
Yeah.
We didn't have it. So, yeah, it's just the world we live in right now.
Yeah. But that access, when you mix all of this together, access to quality health care. I mean, one of the things that I have always respected about you is, the care that you provide your patients. I can't tell you how many times I've been talking with one of the boys, and they all call you Dr. Leslie. They're like, Dr. Leslie called.
That's funny.
But they talk about you where you're proactively checking on them.
Yes.
And
you have to.
I know.
In
but
rural America, you have to.
Yeah.
You have to. You don't want I just pick up the phone at 7 o'clock at night or on a Saturday night or whatever and call and check on my people, because sometimes they're really sick and they may not have an aunt or an uncle or a kid or anybody that can check on them, and so you have to. It's just the world we live in. We have to take care of one another, and so I am very, very blessed to have very, very good patients who don't abuse it. And I know most of the time if they're calling me, it's because they really, really need something, and so I'm honored. I don't know if you realize this or not, but several years ago, I won an award in our area for being the rural healthcare provider in the state of Illinois. I don't know why, if it's my work with the Amish or what have you, but I go to their house a lot, to take care of them, whatever that looks like, to get the people taken care of.
They're that community. One of the gentlemen in that community, I was friends with several of the guys, and still am friends with several of that people in that community. Yeah. We were out loading lumber on a trailer. We were restoring a 250-year-old barn I have right down the road, and he passed out. And I got him up on the trailer, and then projectile vomit, and I didn't know what his belief system was about hospitals. I said, you know what, I'm calling 911, and we're taking you to the hospital. If But that community need care. Yeah. And that access to care, and people, the idea of a doctor coming to a house anymore, it's not going to happen. It's just not common enough that I even hear about it. Mm-hmm. So
I'm hoping that we can change that. I'm hoping there's whether that's nurse practitioners or PAs or physicians that get back to those roots of taking care of the people, whether they can get to you or not, whether they can afford to pay you or not, whether they can afford to pay their medication or not. You do whatever you can to make sure that they get it. And hopefully we'll get back to that. I don't know.
I look at you look at the boomers, our parents and our parents' parents.
Yeah.
You had these generations that slowly moved away from where they grew up. And Dina and I were that way. We lived in Atlanta. Her family was 4 hours away. The closest relative I had was an 8-hour drive. And it was tough to get by. We didn't have a lot of friends in Atlanta. We were both, young professionals working in jobs, and our jobs were downtown. It's, that we need in today's healthcare, you need an extended family, even if that family is friends.
That's right.
To help.
That's right. And I think, the other important piece about when you talk about that and living in rural America as it pertains to healthcare, it's very important that you find a healthcare provider that you can develop a relationship with.
Yes.
I'm not saying one that you go out to eat with on a Friday night or, anything like that, but somebody that you feel comfortable picking up the phone and saying, hey, I've got this going on or I've got that going on and I need help.
But, that's like anything else. If we have that relationship, you're going to know I'm not going to waste your time calling you about a hangnail.
Right.
but it's also, that respect of your time.
Yeah.
We have to do that, knowing how many patients you have to care for.
Yeah. Yeah. And no, I mean, that's just the job that we signed up for.
Yeah.
Whether we have 10 or 10,000. I mean, that's what we have to do is take care of our patients.
What can, in the small community like we have, I think people take Ferrell and Harrisburg, take them for granted because they're big facilities and people think, oh, they've got lots of money. Well, that's not really the case.
No, not at all.
What can we do in the community to help, is there something that the community can do to help alleviate this other than, maybe not every crackhead running to the,
Oh my gosh, that's such a good question. I'm not sure. I'd have to really think on that. It's very important. Every 2 to 3 years, maybe every 5 years, our organizations do a community health needs assessment. And so if you ever have anyone that reaches out to you from the hospital about that community health needs assessment, jump in there, offer whatever information or data that you can, because that's how they develop their plan of care or how they're going to provide care for our community over the next 5 to 10 years is from that community health needs assessment. So that's one thing that I would say would be important. And anytime they have fundraising events, we do the Howl at the Moon, the piano, the dueling pianos, those sorts of things. If you can get involved in anything like that, I would say please try to do that.
the census is one.
Yeah.
I know people who don't want to fill out the census, but you know what? Being counted helps because it shows the numbers and the real numbers we need, which affects federal funds distribution.
And I think people don't realize that.
Yeah.
I don't think they know that. Yeah. Those are all good things that can be done. Yeah. And if you see healthcare providers, pat them on the back and tell them they're doing a great job, whether you truly believe it or not. They are. They're overworked. They're underpaid. They're tired.
I've been into the hospital to see Kara once or twice when she's been working there, and I have yet to meet a nurse in our local area who is not trying their best to do their best in a tough situation.
You're right. And we have, and I'm biased, but we have some of the best nurses across the country. We have the #1 nursing college right out here, nursing program in the state of Illinois. And it is an accredited program. We have amazing instructors out there. We have amazing leadership at our college, and they can only turn out so many nurses per year. And those nurses get swallowed up by all of our organizations locally. But we have amazing nurses and educators, and I'm just really proud of all of them. But they get tired.
Yeah. Kara would talk about nursing school there, and she said it was brutal.
It's hard.
It's hard.
It's hard.
She Kara's a smart girl.
Yeah.
And she would come home and say, Dad, I don't know if I can do this.
I always tell them, I was the same way. I always said if nursing was easy, everybody would do it, and we wouldn't make very good money at all. But I would come home and I would tell my mom, and my mom laughs about this, and she still talks about it. I'm like, Mom, this is it. I'm just going to have to go work at McDonald's or do something different because I'm pretty sure after that test today, I'm done.
You'll have to ask Kara sometime. She was taking one of her first exams that was proctored.
Yeah.
And, I'm a musician, and so I was just sitting out in the living room, wasn't thinking anything about it. You'll have to ask her about that because I decided to tune a ukulele. And she's texting her mom going, Mom, do you believe that?
That's not what you do, John. Wrong thing to do. That's hilarious. But no, we had great instructors out there. Sabrina Stout is out there.
Yes. Kara just loved her. Just loved her. Yeah.
Amy Murphy, she retired. There's some new leadership, but they're all absolutely wonderful.
And you hear great things when you mention that school. You hear providers in the area talk about the quality of knowledge they have going in.
You can tell when you have nursing students with you, whether they're from SIC or they're from another organization. You can tell which the ones are from SIC.
Right.
They're just a notch above. Absolutely.
We've had a good time here. I think it's been one. We should do this again in a year.
Yeah.
We should talk about, one thing that I would like to talk about, and we'll just kind of go on here for just a second, is the stigmas of mental health, especially you farm, we farm.
Yeah.
You know, farmers are not good about saying that, and it's one of the has one of the higher suicide rates of any industry. It's not the highest, but it's one of those things because you have that stigma of asking for help, and I think that would be real interesting to have a conversation about.
I would love to do that. We need to do that. There's a sense of pride and embarrassment that goes into that.
Yeah.
People they don't want to speak up. They're afraid they'll be labeled. That's a huge problem.
It is.
Yeah.
You know, there's the old joke that the farmer goes into the emergency room and the nurse goes out there and she's triaging and going out to ask whatever everybody's wrong and says, oh, the farmer said, oh, it's nothing. So we just put him at the back, and the nurse runs out and she goes, I got to ask you, what was he doing? And she says, I don't know, and goes back out and asks him, and he says, well, I was putting the fence up. And she comes back and says, well, he's putting a fence. And the nurse says, this is really important. You have to go ask him immediately. Did he finish the fence? And she goes back out and goes, sir, did you finish the fence? And he goes, well, no, I'm here. And she runs back and you hear the stat cart coming, you know, because we do have this pride about, you know, I don't need your help. I can do it myself.
Absolutely. Absolutely.
And that's a problem. But we should definitely
we need
do one.
to.
You know, there's a mental health week. I forget when it is, but we should do it on that week.
We should.
Yeah.
And I have some friends who work in mental health. Maybe I could bring them with me.
Oh, that'd be great.
Oh, yeah.
That'd be really cool.
Yeah.
Leslie, thank you so much.
Thank you for having me.
Yeah.
This has been fun.
Good. Everybody have a wonderful day. Good luck. God bless.